Are you ready to feel better? Do you want to make a resolution that lasts? Maybe you're thinking about making your life better in some small or large way. Maybe it's a lifestyle change like losing weight, following a healthier diet, and starting an exercise routine. Join Reverend Horace Sheffield and other health experts on the Word Network. You too can choose healthy life.
Welcome everybody to Choose Healthy Life Presents. You're ready to feel better, make a resolution that lasts. With all things that we do, we want to begin this program in prayer. Lord, we want you to help us today to address our health challenges as a community, that we might be aware of the health disparities that indicate this proportionate number of us being ill impacted by global pandemics and other things. Bless our Choose Healthy Life leadership and churches to be able to answer that call, to be able to help us to live and lead healthier and better lives. And we pray that our examples may be a lamp unto our feet and a light unto others' pathways. Amen. Again, welcome to Choose Healthy Life Presents, ready to feel better, make a resolution that lasts. The pandemic brought to broad public attention what communities of color and low-income communities have long known, that underlying inequities of race and income and geography put our communities at higher risk of contracting the virus and with lower levels of access to vaccines and to health care. We are here today to raise awareness of resources available in our community to help us maintain and monitor our health with a focused discussion on how we can engage, educate, and empower ourselves. We will take a timely look at how Choose Healthy Life is providing essential resources, training, and support to the Black church to address barriers to good health and equity. We have brought together leaders in faith and science to contribute to the discussion of the resources available to help them maintain and monitor their health with a focused discussion how they can engage, educate, and once again empower themselves. Dr. Martin Luther King said, of all the forms of inequity, injustice in healthcare is the most shocking and humane. This quote by Dr. King made during the 1966 press conference in connection with the annual meeting of the Medical Committee for Human Rights still rings true and loud today. As we take time to reflect on the contribution of Dr. Martin Luther King Jr. to human rights and equality in the U.S. and across the world, we're reminded of how his legacy calls out for the improvement of the health and well-being of our communities. We should also reflect on how his legacy can be used to eliminate the healthcare disparities that so disturbingly affect the underserved and underrepresented in our communities. But before we move on and introduce our next guest, we have to take a moment to reflect on the life and legacy of Dr. Kelvin Butts. I first met Dr. Butts when he was working with C. Dolores Tucker back in Harlem when I was a seminary student, trying to trample on trash talk or vile and violent language in the rap industry. He became a friend of mine, a mentor. I mean, his legacy is imprimatur, is felt across this country, having filled pulpits all over this nation. Raphael Warnock, our senator at Ebenezer Baptist Church, is one of his proteges. And he is one of the founders of Choose Healthy Life, without whom this initiative would not be where it is. And so we pause today to salute a life well lived. My father often said that the true measure of a person's life is not how much they have, but how much they give. Dr. Butts had a lot, but he gave a lot. God bless you, Dr. Butts, and may you rest in eternal peace. Well, my pleasure to introduce somebody that I really have come to admire. I think his presentation and his articulation is beyond anything that I've ever experienced before. That's Dr. Reed Tuckson, co-founder, Black Coalition Against COVID-19, and a member of the Choose Healthy Life Medical Advisory Board. Welcome to the program, Dr. Tuckson.
Thank you so much, Reverend Sheffield. I really appreciate being by your side today.
Well, since we're talking about Dr. King's legacy, and this is being actually viewed around that time, how has his legacy impact medical care in your life?
Well, his vision is, of course, extraordinary, compelling, and causes us to become active. I really am deeply rooted in Dr. King's vision of the beloved community, a community grounded in love, a community grounded in respect for the dignity of each person. a vision that is a comprehensive recognition of the conditions necessary for a spiritually informed, healthy, and loving community that brings all of us together to fulfill God's highest purposes for each one of us. And so I really have coming to understand in all of my career just how powerful that vision is and how necessary as it is. Reverend Sheffield, as you and I will learn from our distinguished guests coming up in just a moment, we really have to focus on keeping ourselves healthy as we do our part in God's plan for our lives. And we will also learn from our guests just how important it is for us to work on the social conditions that are absolutely necessary for healthy individuals, families, and communities. And so my vision of public health is deeply, deeply grounded in the idea of the beloved community, and above all, a respect for all people. When we talk about Black Lives Matter, that is more than just a slogan. Those lives, our lives, must matter. And if they're going to matter to anybody, they better matter to us first. Let's do our part in fulfilling God's dream for each of us as individuals by being healthy and doing the things necessary to be healthy. Well, to get us started on our program and to talk about the role of Choose Healthy Life in this prescription for health, we want to begin with a focusing quote from Dr. King. He says to us that we are now faced with the fact that tomorrow is today. We're confronted with the fierce urgency of now. In this unfolding conundrum of life and history, there is such a thing as being too late. This is no time for apathy or complacency. This is a time for vigorous and positive action. Well, joining Reverend Sheffield and me at this moment, we're happy to welcome Deborah Fraser Howes, founder and president of Choose Healthy Life. And let's get us started, Deborah Fraser Howes. As the country navigates the compounding crisis of the COVID-19 pandemic and the disproportionate impact on marginalized community, how has Dr. King's work inspired your approach to public health education, research, and your work?
Dr. King, thank you. Thank you for having me, Dr. Tuxen. Dr. King was a fierce leader. He had no fear. And from what I understand, fear and faith cannot live in the same place at the same time. If you fear, you don't faith. If you faith, you have no fear. And we are at a place now where, when you talk about the fierce urgency of now, he was speaking to the civil rights movement and saying that we don't have time to wait. And it's the same thing that we need to say about our health. We don't have time to wait. We saw with COVID-19 what one single virus can do to an entire community. It killed so many of us. And for those that it did not kill, now people are suffering from long COVID and having, continual problems. This was already on the heels of our numbers in diabetes, our numbers in heart disease, our numbers in cancers, our number in obesity. And if we don't take care of what we need to now, the fierce urgency of now, we're going to be susceptible to every virus and every malady that comes across this country. And with climate change and the changing sort of attitudes and focus in this country as we know it, it seems that we're going backwards and we're not going forward. And we have to go forward and we have to save lives. And one of the ways to save lives is what we've done with Choose Healthy Life. In the middle of the epidemic, and I saw what was going on, and with my background in HIV and AIDS, when I founded the National Black Leadership Commission on AIDS, I brought together all of the Black leaders that we had in New York. The focus then was, in Africa, in the African tradition, we tended to, like the griots, we tended to bring together the leaders of a community to solve various problems. So it was on that concept that we started the National Black Leadership Commission on AIDS, and the goal was to stop the death, the outrageous death in the black community from HIV and AIDS, and to get people tested. In doing so, we brought together ministers from all over the country and to be on our board, and those ministers started to speak to the importance of getting tested and got themselves tested. And we saw the testing rate in the Black community rise to a level that we had never seen before. And we understood we had something there. And with the union of the Black doctors from the NMA and other doctors that were in the community, helping the preachers to get the word out in the community, this transformed where we were starting from, because in actuality, no one was going to help us but us. We understood the fierce urgency of now. So the same concept happened with Choose Healthy Life when we saw the death rate from COVID-19. We again called the leadership, this time focusing on the clergy and medicine and science, our scientists like yourself, Dr. Tuckson, and we brought those two powerhouses in our community together to address COVID-19, testing and vaccinations. But it wasn't just that. We always knew that we had to deal with those underlying health issues that made us so vulnerable in the first place. And we had to put together an infrastructure that would allow for the community to have a place that they trusted, people that they knew cared for them, somewhere to go to get the information and the services they needed, and that was the Black church. So we created this infrastructure, a public health infrastructure in the Black church to make sure that happened. Now we're not out of COVID. So I want people to really understand that. We're not out of COVID. And there's a number of vaccinations that people should be looking at for themselves and their children. And so we're not out of the woods around COVID vaccine yet, but we are in a different place. And we're in a different place because our clergy and our medical people came together to make it so.
That's
so
that is very perfect. That is so great of an explanation. And let me give a tangible example of that and bring Reverend Sheffield into the conversation very quickly. And Reverend Sheffield, I know that one of the things that you have been most embracing of the Choose Healthy Life movement in your work in Detroit has been the role of the health navigators. Could you just give us a description very briefly of what that is all about and how the navigators partner with the clergy and partner with the health system that Deborah has just outlined?
Sure. Well, it's about trusted servants. And I will tell you that Choose Healthy Life has been on the forefront of bringing Medicaid, Medicare reimbursement for Choose Healthy, community health navigators begin in Michigan in October. And we've been on the committee helping write the legislation and putting in place how that will happen. But our community health workers go into homes. They're doing remote blood pressure checks. We had 500 folks sign up in the blood pressure program. 80% of them reduced their blood pressure to normal within 10 days and have maintained it there for almost a year. Could not do that. We have 13 community health workers, 10 that are paid by Choose Healthy Life, 3 that we pay for. And they go in the homes. They conduct screenings in churches. They address almost every kind of thing that affect African Americans, and they do it on their topography. They go in their homes. They go into nursing homes. They go into churches. We've even gone into barbershops. And so to have that kind of frontline interaction with people who are reluctant, even with health insurance, to go to a primary care physician has been phenomenal.
Wow, thank you for that. Deborah, as you look at other elements of the Choose Healthy Life movement, in the last 2 minutes that we have to discuss this, what would you also want to augment as being the most important aspects of the program in your mind as the leader of this movement?
Well, one of the most important aspects of the program was the fact that we were allowed to fund the churches so that they could have an infrastructure, so that they could take on multiple issues around health in the community. The other was like as Reverend Sheffield said, the ability to hire a staff person in each church so that that person can go out into the community and gather people in, as well as deal with the people in the church. The third is what we're doing now called the Blueprint for Wellness. And it is an instrument that actually allows you to test for a number of different things: liver health, kidney health, heart disease. It allows you to have this exam, and it gives you a report card on just where your health is, your health status, so that you can take that to your doctor. And if you don't have a doctor, the health navigators will connect you to a medical home. Those are the big pieces of it. And of course, the union of faith and church and medicine.
Well, thank you so much to Deborah for your leadership and for your participation on this program. And thank you, Reverend Sheffield, for your leadership. Now it is time for us to turn to our panel of distinguished physician experts who will help us to understand God's prescription for health and how we can implement that prescription into our daily lives, into our daily spiritual life. After all, aren't we seeking a wholeness that brings our physical bodies and our spiritual souls together? Well, let's explore how we might do that together as we fight for our individual health, that of our families, and that of the communities in which we live. We now get turned to our good friend, Dr. Marcela Nunez-Smith. Well, we're very pleased at this point in our show to invite a friend of so many of us, and certainly a friend of mine, Dr. Marcela Nunez-Smith, who has multiple titles, but just to give you a sense of her qualifications, she's a professor of internal medicine, public health, and management, and the founding director of the Equity Research and Innovation Center at Yale University. We first met her as co-chair of the Biden-Harris transition team, and as the COVID-19 Advisory Board and chair of the COVID-19 Health Equity Task Force. And so she has served this country and our people with distinction. Dr. Nunez-Smith, you are, as introduced, an expert in health equity. Could you describe briefly what that means and what most concerns you as we go into 2023?
Yes. Well, Dr. Tuckson, it's so good to be with you in conversation today. This does feel a lot like a reunion. And so, I know there are many people out here too. This expertise is shared among so many you and so many who are in the audience now, but it is good to start this conversation by that frame. And, depending on the day, I have a different emotion when I talk about health equity, but right now I'm feeling like it's joyous, right? We can get there. This is about opportunity, setting an opportunity agenda for everyone, all of us, to achieve our best health, right? Achieve that full potential. But we have to speak some truths, right? And that's what equity pushes us to do. It's not just to name a difference, identify a difference. Everyone knows that so many of our communities carry a heavy and disproportionate weight when it comes to illness, physical illness, and let's talk about mental illness too, right? But we have to talk about root cause, and we need to name all the structures that have gotten us to this point today and speak to the intention behind so many of the policies, whether it be redlining and housing, challenges to accessing the same economic opportunity, the same educational quality as everybody else. And that's the reason, this isn't a conversation about individual choice that we make. That plays a role, yes. But equity says, no, we need to interrogate systems, structures, policies, intervene there. And that's really how we're going to make positive change. And so at this moment, I'm feeling joyous about 2023. We know, we just need the political will, right? We know what to do. And understanding that the role is there for each one of us in this process to do that part, whether it's leading the policy change ourselves, making difference in our own households, our neighborhoods, our communities. So as we look to 2023, I do have worry. My one worry is that we lose sight, right? That this moment, right, does not become the movement and the momentum we need it to be. The pandemic, it it really made clear, truth known to so many of us, but to everybody, why there are differences in this country between racial and ethnic groups as a start. And there was a big rally cry around this. What can we do now? But as we go into 2023, will attention shift? Will people move on to something else and not keep that North Star focus on health equity? So that is my worry. But I know today that I'm with soldiers and champions in this battle who will make sure that we stay to task.
Well, let's give the marching orders to the soldiers. You are part of the family. The Black Church, as well as Black community-based organizations, are many of the places that you interact with the most. What's your prescription, Doctor, for the Black Church and other
Yes.
community-based organizations as we go forward in the coming days and weeks and months?
Yeah, absolutely. We're going to lead this charge. And it is the right prescription to say be fearless. Be fearless and be bold. This is not a moment for shyness. This is not a moment to be passive. This is a moment to lift our voices and lift our power and our agency. And that's a message I want to bring because I know people are tired, right? People are tired. We've been at this work a long time. And I always say this is work. We're all standing on the shoulders of so many generations of leaders and advocates and champions. This is nothing new in any of our communities, in the Black church, in community-based organizations. This has always been how we center. But I want to name and recognize, right, that people have to take care of themselves along the way. So that's part of the prescription, even as we do work in the service of others. And we do that in a systematic, coordinated, and organized way, right? In a systematic, coordinated, and organized way. Because I think that's really where our power is. When we agree on an agenda and when we can in one voice speak to that agenda, that's where we're going to make difference. But even as we do all those good works, let us take care of ourselves and of our neighbors on that journey.
Wow, that is just such a beautiful message. And as we, in the few moments that remain, I want to underscore two things that you've said. First is this need to be coordinated and organized. And I think that what the Choose Healthy Life movement is all about is trying to bring people together around a common agenda. And the second thing you said is that we stand on the shoulders of others. I was thinking as you were talking about the great Ella Baker, civil rights leader from down south, and she often said, "Ain't no ways tired." I get the sense that you're not tired, Dr. Marcella Nunez-Smith.
Listen, it's
Not at
because I
all.
get to be
Well,
in community with you, Dr. Tux, with somebody else, right? And that brings me energy, it brings me joy, brings me faith and optimism. And I say together, yes, we can.
that's great. And the other thing, I just as we end up, I just want to applaud you. I was very inspired by the approach you took to the answer to my first question. Instead of being a negative, oh my God, woe and doom, you're optimistic, you're positive, you're can do. And I think it's that energy that we have to go forward with in the new year, that confident and positive, and that we can meet our challenges. So thank you so much, Dr. Marcella Nunez-Smith, for sharing your insights and your observations and reminding us of the importance of addressing these social conditions that have so much to do with whether or not we realize the optimal health for our people, our families, and our community. Thank you so much for joining us.
Thank you. Be well, everybody.
Well, it is our pleasure to bring forward one of my most trusted and valuable experts, and someone who is a friend of Choose Healthy Life and the Black Coalition Against COVID, Dr. Yolanda Hancock, founder and CEO of Delta Health and Wellness Consulting, and as I mentioned, a co-founder of the Black Coalition Against COVID. Uh, Dr. Hancock, I have found you to be one of the most caring and compassionate pediatricians that I know. As you engage with Black parents and their children, what are the health issues that most concern you with young children?
When I think about the health issues that most impact our youngest children, I think about really the social determinants of health, those factors where, in this context, a little one is born, grows, learns, and lives, and then where their parents work and how their parents and those other adults around them age impacts them directly. When I think about our youngest, what's most concerning to me really is maternal and infant health, how a little one, even inside the womb, is protected, then facilitates or protects against other health issues. We know in this country that there is a Black maternal health crisis. Black women are 75% more likely to die during childbirth. I just had a new set of twins added to the practice who nearly lost their lives, as did their mother. And when you think about the level of stress that Black people experience in this country, but particularly Black mothers, expectant parents, it can be almost frightening when you find out that you're pregnant, given what we know the statistics to be and what the outcomes to be, right? Because what ends up happening from conception all the way through after birth can then set a child up for significant complications later in dealing with preterm birth, low birth weight. All of those increase a child's risk of having cardiac complications, lung complications, all of these things, and just the stress in and of itself. I know for myself as a mom, when I was pregnant with my daughter, I knew too much, right? Both having a background in medicine, but also having a background in public health and knowing what the statistics were for Black women in terms of our birthing outcomes. I had anxiety, to be honest with you, Dr. Tuxen, and that anxiety feeds into our pregnancy. Cortisol levels go up, stress ends up happening, blood sugar, blood pressure, all of those things are impacted by our experiences, both before we got pregnant, when we're really honest with ourselves, what a person's preconception health is. We often talk about cardiac health being one of the leading factors in maternal mortality, but we don't often talk about what leads to our maternal cardiac health not being optimal. I have the blessing of being one of the board members for the American Heart Association's Greater Washington region, and one of our areas of focus is in maternal heart health. We think about what's happening preconception, what's going on with a woman's blood pressure before she gets pregnant, what happens to a woman's blood pressure during the time that she's pregnant, and even in that postpartum period. That can impact whether or not she survives having a baby and then how she's able to show up. So when we think
Wow.
about how a child starts out, it is critical that we optimize our health even before we decide to have a little one so that both our and our baby's health outcomes can be the best they can.
That is just such a powerful point. And so I think as you're teaching us, if you love Black children and care Black children, you have to care about Black women. You have to care about Black mothers during the process of pregnancy. And that means
Right.
we all have to sort of come together. Well, let me switch from the little ones to the little older ones, to the adolescents. What are the issues that most concern you as you engage with your adolescent patients?
My most concerning issue right now, Dr. Tuxen, is mental health. We know that Black children are over twice as likely to die from suicide compared to their white counterparts. And this wasn't always the case. I will tell you, when I trained to become a pediatrician, it's my 20th anniversary of graduating from medical school in 2022. So I'm 20 years in the game now. But when I was training, suicide was very much a white issue. We were taught in pediatrics that homicide was the issue that was plaguing Black children. Right now, our children, particularly our adolescents, are dealing with both homicide and suicide simultaneously. And as you and I have worked on in our Black Coalition Against COVID, the impact of COVID-19 2 years later in our report that's forthcoming, we speak specifically to the impact that the pandemic has had on Black children's mental health. We know that our children are at higher risk of anxiety, depression, and suicide. But when you think about the underlying issue, it's really about stress. I think about a little one who died of suicide back in 2018, a little boy named Rylan Harum in Washington, D.C. He was described as the perfect son, the perfect student, played basketball, played trumpet, all of these things. His mother was dealing with housing insecurity, dealing with poverty. She thought he was protected against that, but children are not. They're fully aware of what's going on with us and they take in that stress. They internalize it, but often they don't know what to do with it. And because we as grown-ups get so caught up in what we're dealing with, we sometimes forget to check in with our children. And then when there is an issue, because we experience such a mental health professional shortage it becomes very difficult for us to be able to connect, for me professionally as a pediatrician, and for parents to be able to find resources, particularly resources for children who look like us, who have similar backgrounds, so that our children are able to stay connected to their mental health professionals and really feel seen and heard. And if we don't do anything about it, Dr. Tuxen, my fear is that this disparity that we're seeing with mental health is going to continue to exponentially increase. Over the past 15 years, we have seen a significant increase in suicidality in African American children. Black boys die at 2.5 times the rate of Black girls when it comes to dying by suicide. But when you look at the data, the rate of increase has been faster among Black girls. And so clearly there is work to be done. Part of that is directly linked to the social determinants of health that define 80% of our children's outcome. It's where, as I mentioned before, our adolescents are growing up. It's where they're learning, it's where they're living. In some regards, it's where they're working. It's their lived experience and the lived experience of their parents. And it's also lack of access to support and services to help them when they're dealing with either significant stressors or significant mental health issues like depression and anxiety. We often talk about adverse childhood experiences. Racism is one of the most critical ones that we don't often really consider. And this is both direct and indirect. Our children are experiencing racism directly because of what's happening in our society, what's happening in their school systems, but they're also experiencing it indirectly when they are watching George Floyd being murdered by the people paid to protect us, when they're watching Breonna Taylor being killed in her bed, when they're watching Ahmaud Arbery being hunted down. That impacts their mental health in the same way it does for us as adults. The challenge, though, is that for us adults, we're able to process it a lot better. For our adolescents, sometimes they don't know what to do with it. And we as parents are responsible, not just parents, but every adult in our children's lives, directly connected to them and society as a whole. We are collectively responsible for the mental health of our children. And clearly we need to do better.
Well, this is perfect. We'll have to leave it there. This is a great presentation from you. And I think the take-home message, Dr. Hancock, that you are so eloquent at delivering is it takes a village to raise a child. And there is a role for all of us, whether it is the role of protecting the health of Black women of conceptual age, whether it is protecting pregnant women as they go through the process of childbirth, protecting our young children, but as you have indicated, our responsibility to address the social conditions that lead to such tragic outcomes for far too many of our adolescents as they grow into this very complex world. Thank you so much for sharing with all of us today, and you have a wonderful rest of your day.
You too, thank you.
And now we turn to Dr. Melissa Clark, a friend of mine and the noted social media presenter and author of the book, Excuse Me, Doctor, also founder and CEO of the BHE Group and co-founder of the Black Coalition Against COVID. Dr. Clark, we have just heard from Drs. Nunez-Smith and from Dr. Hancock talking about the importance of addressing the social determinants of disease and also how we can work to keep our children healthy. Now, I'd like to turn to you for your prescription on how we as adults can keep ourselves healthy. As you look to what we should be doing, what's top of mind for you on our prescription for health?
Absolutely. Thank you so much, Dr. Tuxen. I'm honored to be here as a part of this wonderful service, community service that we're doing here today. And I would say top of mind for me are what I call the 5 self-health actions. Those are self-care actions that are just so critical. So the first is nutrition. When you go shopping, spend the time at the periphery of the grocery store, going to the fruits and vegetable section that's the healthiest, the lean meats, getting the whole grains. Eat the colors of the rainbow because those things are what really help to repair our bodies and keep us healthy. The other piece of nutrition is hydration, staying well hydrated. Many people don't realize that the aches and pains and headaches that we sometimes get from time to time, or less energy and fatigue, just come simply from not being well hydrated. The next 2, sleep and movement, I think kind of go together because when you move, you're actually releasing chemicals in your body that help maintain your body's balance and help you stay healthy. And then sleep, the flip side of that, is giving yourself 7 to 8 hours of sleep a night to be able to restore and repair your body. That can only happen when you sleep. And then the fifth self health action, I think, is the most important. And that's finding a daily way to manage the stressors that come at us every day. So I like to talk about people on a roller coaster ride. There are people who are screaming out of fear, some that are screaming because they're having fun, and there are some people who are unaffected by it. That is a stressor, the roller coaster ride. The way that we respond to the stressors in life are really key. And the way that we can maintain our balance are to have daily routines, daily rituals that help us manage the stressors that come into our life. We know that prayer, meditation, exercise and movement, volunteering are all research proven ways to do that. But the key is to do it on a daily basis because we're constantly having stuff thrown at us on a daily basis. So those are the 5 self-health actions. And I just want to also throw in that self-care is one of the highest forms of community activism. Why do I say that? Because by practicing self-care, we show that we matter in a world that sometimes seems to devalue us. Self-care is really a powerful statement of our worth, that our lives matter. And the other part of self-care is it's one of the highest forms of community building. Many people think that self-care is selfish, but as adults, we can't help others until we help ourselves. So if you're part of a family, part of a community, congregation, part of a social club or a fraternity or sorority, putting yourself first is much more important than sacrificing your health to try to get everything done and make sure everything, functions for that organization or that family unit. The family and the community is only as strong as individual members.
It's kind of funny. I sorry to interrupt you on that, but I was just thinking as you were talking that when you get on the airplane, they always tell you to put the oxygen mask on
Exactly.
yourself first and
Yep.
then on somebody else who is in need. Is that what you're getting
Exactly.
at?
That's exactly what I'm getting
Wow.
at. You're only as valuable to others as you are to yourself, because if you're out of commission, you can't help other people. And so that helps to
Well,
build your family, it helps to build your community. So I say going into 2023, self-care is the way that we can serve others and serve ourselves.
so in the 10 seconds that are left, let's just go back and review. Give us those 5 one more time.
Nutrition, hydration, sleep, movement, and managing our daily stress.
Well, thank you so very much. We really appreciate your advice, Dr. Clark, and thanks for being a part of our leadership team. And now, I
Absolutely.
want to thank all of our distinguished medical experts who have joined us. And keeping with our theme of enhancing the close partnership between Black health professionals and Black clergy leaders, we're pleased to bring in 3 distinguished clergy leaders for their perspectives on fulfilling God's prescription for health. To begin our conversation with Black clergy leaders, let's start with this quote from Martin Luther King, where he says, "We must move beyond sending complaints to Washington and act directly." Well, who better to kick off our panel than the Reverend Al Sharpton, co-chair of the National Black Clergy Leadership Health Council, and of course, founder and president of the National Action Network. Reverend Sharpton, health is, as you know well, inherently political. As you look at the political landscape in Washington, D.C., what concerns you most about the decisions that need to be made, which either optimize or threaten the health of people of color?
Well, I think that what concerns me is that usually the priorities that are set in Washington are set by who's in power in terms of what political party and who's in the White House in terms of the same political party. Unless you have a force like Choose Healthy Life that has the clergy leadership that is still a dominant force in terms of citizens of this country, advocating on behalf of those citizens, which says to those in Washington there can be political liabilities to not listen to people like Choose Healthy Life, and therefore democratize how we deal with health. We're not asking for favors, and we don't support candidates, but we are saying that you must have fairness. So when we dealt with COVID, we made sure that communities of color were getting the resources that other communities were getting. And as we continue to fight for choosing healthy life, there must be equity in how public funds, and for that matter, private funds and resources are used to undergird those health initiatives that need be undergirded for our very lives. We cannot have a discriminatory policy of where resources go, whether it be environmental concerns that cause asthma and other maladies, or whether it be testing or vaccination when it deals with viruses like COVID-19 or those that have come behind it. And we cannot, history tells us, we cannot depend on the goodwill of some in Washington. There must be those of us that operate to make them understand that this is important. You started by saying, Dr. Tuckson, about Dr. King. Dr. King always talked about our being a conscience for the country. Choose Healthy Life is a in Washington. And that's the mantle that I think we have in the health area. Martin Luther King said there are two types of leaders, transactional and transformative. We have a transformative mission, and we know how to go to the Hill and transact to protect that mission.
Well, thank you so much, Reverend. That is a great way to start this panel. And let us be very clear that what you are saying is that we have to do both. We are certainly moving beyond complaining in Washington, but to find real solutions. We're providing the government with real solutions for what needs to be done, while you and your colleagues continue to work directly in our communities, transforming the life of our communities. Thank you so much, Reverend Sharpton, for starting off this panel.
Thank you. God bless.
And now it's our pleasure to bring in the Reverend Q. English, who is the Partnership Center Director for the U.S. Department of Health and Human Services, but also, particularly germane for this conversation, is also a pastor herself. From your perspective, Reverend English, as a faith leader and as a member of the Biden-Harris Health Administration, what concerns you the most about where we are on protecting and enhancing the health of our people?
Thank you, Dr. Reed, for that question. If I had to really think about it, and there's so many things that are going on in our nation, but if I think about the top three things, one is definitely maternal health. As some may know and others may not, the United States has the highest maternal mortality rate than any other developed nation in the world. And our Black women maternal mortality rate is 3 to 4 times higher than white women. And in 2020, we experienced over 800, and to be exact, 871 pregnancy-related deaths. But here's the clincher. 80% of those deaths were preventable. So we have a problem in our nation. And when you hear the stats of 3 to 4 times higher with Black women, that doesn't account for all of our cities. Because when you look at New York, they're 9 to 12 times higher. And the number one cause, mental health. And so when I think about the second highest, or the second concern that I have is mental health. Our youth we have seen an uptick in our United States emergency department rooms of 51% adolescent girls aged 12 to 17. And then when you look at our Black boys today, for the first time, they're now exceeding that of their white counterparts as it relates to suicides. That's why our Surgeon General declared a national emergency in 2020 for youth mental health. But even going beyond youth mental health, Let's look at our healthcare workers. Let's look at the first responders. And let's not forget our clergy, who today are leading while bleeding. And it's a sad state of affairs because a lot of us, particularly our Black clergy, don't seek help because of the stigma associated with mental health. We have over 2,000 pastors leaving the church per month. I would say that is a major concern. And as I go back to maternal health, we are embarking upon a national maternal health tour, particularly for Black women. And we're going to do that around our nations with hopes to reaching 25,000 women, certifying 500 doulas, tying not only their babies to resources in the form of a community baby shower, but tying them to needed resources from prenatal care to mental health care and more. And so my third issue I would say would be substance use disorder, particularly in this opioid epidemic, and fentanyl topping the chart with 105,000 deaths last year, the most we've had over the years in the United States. So those are the three things that we need to think about as faith leaders. What more can we do? What can we do as we think about partnering with HSS on this national tour for maternal health to improve outcomes, address the racism, the healthcare inequities, and more? What can we do to improve mental health? How can we become better in helping our youth? What do we need to be equipped with? And what do we there?
Well,
But
thank
how
you
do
so
we
much,
address
Reverend
that?
English, for those
These are the
observations.
things,
And what I'm
Dr.
taking away
Tuckson,
from your
that we need
comments
to
are really
have
two things.
a
Number
more
one, the importance that that all of us must Well, thank attach you, to our Reverend moral English. and This has been a civilizing very responsibility to important embrace perspective women for of us. And I know childbearing that I'm age, taking to make home sure from that your when comments they go through the the process importance of the of faith birthing community and our the whole next community should do generation what of any African civilized American society children, must that do, those and that children is to have the embrace optimal the chance to be women as healthy who as are of possible, so childbearing that the age, and mother making can be as sure healthy as that possible, they and have so an that all of them opportunity can to live have the the healthiest best pregnancy and maximum produce level of children their who have an God-given human opportunity to potential. maximize the And full we extent of their also need to God-given human remember to potential. focus So thank you for that point, on and how thank you we for deal with making the mental point health. And about above all, mental as you have health and the indicated, importance that we being must honest have in and our open community about talking to talk about to each mental other health openly and challenges. honestly Stay about it. tuned for more of that from the Choose Healthy Life movement in the days to come. And now it's my pleasure to introduce the Reverend Matthew Watley, pastor at Kingdom Fellowship AME Church in Silver Springs, Maryland, who is one of the great leaders of the Choose Healthy Life movement. Reverend Watley, I have always admired your ability to create an organization that not only addresses the spiritual concerns of your congregation, but also engages with the social determinant challenges for optimal health for the community around your church. Based on that, what lessons have you learned that you can share with our audience as we move forward to make a real difference through our church-based health efforts?
Well, thanks so much, Dr. Tuckson, for all of your leadership. You have been so helpful in aiding the Black church in doing what it has always done historically, which is to serve as the comprehensive institution for commerce for our community, whether it's political or economic, whether it is social, or in this case, health. It all happens because of the Black church. We are in every community. We are organically and spiritually rooted to our congregations and to our neighbors. And as a consequence, we've sought to try to provide means of access to the healthcare community through our churches, serving as a conduit. We recognize that the work of Dr. King was not just spiritual, but it took into account the entirety of the holistic health of individuals within our community, which, as you just indicated, are are overrepresented in every negative health indicator almost in our country. And so, as an example, our church, we have a separate building that we have dedicated towards turning back the rapid and rising tide of negative social determinant of health indicators. So we have a food bank. In addition to that, a clothing store with no cash registers. We have a partner in Holy Cross Hospital to provide health care to this community, which is so underserved, in addition to workforce training as well as business incubator and business accelerator space. What we recognize is you can't come at one part of the puzzle. You've got to put all the pieces together. And so we're very intentional about making the stand and the demand for not being left out when other pieces of the puzzle are given to other communities. We all know that the communities that we represent are indications of the decisions that are made, both from the White House, the State House, the courthouse, but also the economic houses of our land. And so it's incumbent upon us as the African American Church that we continue to stand on the wall and to serve as advocates, but also to serve as empowerers of our community. So we don't just want to preach about it on Sunday. When I leave the pulpit on Sunday afternoon, my assignment is to work from Monday through Saturday on addressing the felt needs of our community. We saw that during COVID, that when churches and pastors stood up with the assistance of health leaders like you, Dr. Tuckson, we were able to turn the tide against vaccine hesitancy. We recognize that this fight is not over and that we still need to convince others in our community. But it starts with the Black church. And until we recognize its place in our community, we will not be able to overcome the challenges that continue to plague us.
Perfect. Well, thank you so much, Reverend Watley. And one of the things I think that you offer the Choose Healthy Life movement is tangible examples of how to get good ideas done. You move from rhetoric to reality. And I would urge those who are in the faith community watching this show, be confident that you'll be able to reach out to Choose Healthy Life for their lessons learned in churches such as Reverend Watley's, so that you might pattern some of what you are doing after proven models that work. Thank you so much, Reverend Watley, for sharing that experience with us.
Thank you, sir.
And now, as we close out our program, I want to thank all of our medical and clergy guests and experts for their participation in our town hall. We are all focused clearly on the quote that we began this program with from Martin Luther King, where he teaches us, reminds us, and challenges us that of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. All of us at Choose Healthy Life are determined to do everything in our power to protect and promote the health of all of the people who live in our communities, and in fact, in increasing the healthiness of this entire nation. And now we turn it back to close this out with the Reverend Sheffield. Reverend Sheffield, take it away.
Thank you, Dr. Tuckson. Inspiration without action is meaningless. Follow these quick tips to activate your inspiration and spread this message we've given you tonight. Check medical appointments. When was your last one? Your next one? Do you need to make one? Call a friend and check on them. Ask how they are doing. Ask if they're taking care of their health and need assistance. Do what you can to make certain life is better for them. Become more social. Help educate your community by sharing health information on your social media channels from reputable sources and from Choose Healthy Life. Just share one thing. But whatever it is, do it now. Don't wait. Do something today to make you and your community a healthier place for everyone. I want to close with a prayer. One was offered by Dr. Martin Luther King Jr. himself before giving testimony to the Platform and Resolutions Committee during the 6 days of hearing of the Democratic National Convention in Chicago, Illinois on August 11th, 1956. Oh God, our gracious Heavenly Father, we thank Thee for the privilege of assembling here. We thank Thee for all the opportunities of life, and we stand together today and discuss vital matters confronting our nation and confronting our world. We ask Thy guidance be with us in all deliberations and help us at all times to seek to do those things which are high, noble, and good, and to make our nation a great nation, a nation that follows all of the notable precepts of the Christian religion and all of the notable precepts of democracy. Grant, oh God, that as we move on, we will move toward that city which has foundations, whose builder and maker is God. Amen. God bless you. Happy Dr. King birthday, and choose a healthy life.
In 2020, Early in the pandemic, we could see from our testing data the disproportionate and devastating impact COVID-19 had on the Black community. Compelled to act and help address the crisis, we launched Quest for Health Equity, a more than $100 million initiative focused on providing a combination of donated testing services, educational programs, and funding to address and reduce health inequities in underserved communities across the country. Choose Healthy Life was one of the first organizations we teamed up with to support under-resourced communities in New York City, Newark, Atlanta, Detroit, and Washington, D.C. Through funding provided by the Quest Foundation, Choose Healthy Life and the United Way of New York City established a church-based community health workforce to help neighbors obtain vital healthcare services and resources. One of the causes of high mortality rates in the Black community from COVID-19 was the presence of underlying conditions such as heart disease and diabetes. These conditions, which put certain groups at higher risk, haven't gone away, and if anything, have been underreported during the pandemic. We know that 60% of Americans deferred care during the COVID-19 pandemic.
That is why we are proud to build on our commitment to CHL by offering Blueprint for Wellness, a comprehensive health screening that will be available to provide powerful information to underserved Black communities to support preventative care and wellness. It is vital that the members of the Black community return to care and obtain the necessary testing needed to prevent these conditions from starting or from getting worse. By knowing your numbers, you are empowered to achieve better health by choosing a healthy life.
The Black clergy leading this effort and the role that the church plays as a leader in this effort is based on our history in the community. The African American church was the first place of social cohesion, the first place where we could get together and talk and learn. And so we are continuing in that role. We're bringing people together, and people come here because this is the most trusted institution in the African American community. The clergy, the leaders of the institutions, themselves have to be examples.
This announcement, which brings Quest and brings a governor that's been productive and a community together with faith leaders, is historic. It is needed. People are in real need.
Everybody says, you know, when are we going to get back to normal? We've got to get back to normal. Well, we can't go back to normal. We died in normal. This program sets a new paradigm, and one that will allow us to choose life over death. Allow us to hire health navigators in each of these churches on the ground to be an army, to go out into the community, to link our people to the health services that they need.
I'm Michelle Drayton. I am with United Way of New York City. We're the implementation lead for Choose Healthy Life. It's a groundbreaking initiative with the church at the center of health and wellness. And we're really looking forward to implementing the wellness phase of Choose Healthy Life, where we're going to be focused on health, nutrition, addressing chronic disease, and overall wellness in our communities.
As we enter into our third year of Quest for Health Equity, we are excited to see the expansion and evolution of our work with Choose Healthy Life as the program's first major partner in the fight against health inequity. Together with their extensive relationships with the Black clergy and now government support, we are shaping a movement to enhance the healthcare and overall wellness of the Black community. We look forward to this next stage in our relationship with Choose Healthy Life and are delighted to bring Blueprint for Wellness, our critical health tool, to more people in key cities so that they can obtain the insights and care needed to support their overall wellness.
We are proud here today to announce our next commitment, which is offering something we call the Blueprint for Wellness. It is a laboratory panel that allows individuals, again, to see what's going on inside their human body. It is something that 50,000 Quest employees get on an annual basis. It's the same identical product that we offer to corporations and to medical societies across America. It is the same product that we are bringing right here.
we came to give them something for their spirit by giving them hope about what the future holds for them, about their health, something that we take for granted. And so in partnership with Quest, I'm pleased and proud to be a part of tomorrow's movement.
It's just wonderful that now I can come out and get a printout of my health and all my vital signs and everything, so I know what I need to do to stay healthy.
One of the things that we hear a lot about is, I don't have access. I don't know where to go. I don't know where to seek help. And this is so important for our community, where now that we are seeing the light of day, we're feeling that there's been a transition made today. And this is a historical moment to say that we're now going to intentionally increase access to care for our Black and brown communities.
Knowing what's going on with your body, that's important. This was a great initiative. I just got tested myself, got my blood work, got my weight, my height. I want to be an example of what it means to be a good citizen of our health.
Being a health navigator has been a blessing and a joy. There is nothing better than seeing people well.
Through our partnership with Choose Healthy Life, our diagnostics tests such as Blueprint for Wellness, and the hardworking health navigators on the front lines connecting communities to care, we are determined to work together to eliminate these health disparities and look forward to continuing this important work to achieve health equity for all.